Posterior cervical spine stabilization and fixation is a frequently performed surgery for various cervical pathologies, and instrumentation extending caudally up to C7 is frequently needed. The current generation instrumentation techniques primarily employ a screw rod design. C7 vertebra is anatomically distinct from the other 6 vertebrae due to its relationship with the vertebral artery and its junctional location in the spinal column. In this finite element analysis, we aim to compare the biomechanical parameters in case of multi-level posterior cervical fixation with C7 vertebra being instrumented by 2 techniques, the lateral mass screw fixation versus the transpedicular screw fixation. CT scan of a middle-aged healthy male individual was utilized to create a 3D finite element model ranging from the skull base to T1 vertebra using Mimic software, Geomagic design, Hypermesh, and Ansen software. The literature recommended intervertebral disc heights were maintained. The ELL, PLL, capsular ligament, interspinous ligament, and ligamentum flavum were used for our model, and the convergence test accuracy was 3%. 4 3D finite element models were created, with model 1 involving C2 pars, C3 to C6 lateral mass screws, and C7 transpedicular screw fixation. Model 2 involved C3 to C6 lateral mass screws and C7 transpedicular screw. Model 3 involved C2 pars and C3 to C7 lateral mass screws, and Model 4 involved C3 to C7 lateral mass screws. Principles of screw trajectory for posterior cervical spine fixation were followed. For each model, a preload of 50 Newton compressive force was applied at the superior end plate of C2 vertebra to replicate the head weight along with variation of moment, and the inferior end plate of C7 vertebra was fully constrained for every model. The same boundary and loading conditions were adopted for all 4 models. Maximum moment at failure, maximum angulation at failure, maximum stress at failure, the point of failure, and the intervertebral disc stresses were studied for the models. The maximum moment generated in flexion motion at the time of failure was highest for model 3, that is the one involving C2 pars and C3 to C7 lateral mass screws. Maximum angulation at failure in flexion motion was allowed by model 3 with 27.8 degrees of flexion, and the minimum angulation in flexion was allowed by model 1 with 22.5 degrees of flexion. At the point of failure, model 1 could withstand the maximum amount of von Mises stress, while model 4 could withstand the least amount of von Mises stress. Model 1 and model 2 failed at the transpedicular screw at C7, model 3 failed at the rod at C4, C5, and model 4 failed at the rod cranially at C3, C4. Model 1 and model 2 showed lesser stresses at C6, C7, and C7 T1 levels as compared to model 3 and model 4. Ours is the first study to include finite element models to study biomechanics of multi-level posterior cervical fixation with lateral mass screws and transpedicular screws at C7. Existing literature includes cadaveric and clinical studies to compare the clinico-radiological outcomes of lateral mass screws versus transpedicular screws at C7 level. However, these studies have primarily employed monosegmental or bisegmental fixation models. Clinical studies require a lengthy follow-up to prove their validity, and conducting cadaveric studies in our milieu is an expensive affair. We hope to confirm the validity of existing data with this finite element study and use the present study as groundwork for future researches. Maximum moment generated at failure was lower for the constructs terminating with transpedicular screws than lateral mass screws. This is attributed to the fact that pedicle screws have a longer lever arm spanning across all 3 vertebral columns, whereas lateral mass screws anchor only to the posterior vertebral column. So transpedicular screws at C7 provide a stiffer subaxial construct. The maximum angulation of the model was also greater for constructs with lateral mass screws as compared to the pedicle screws, and this again is attributed to the tricolumnar purchase of the pedicle screw fixation as compared to lateral mass screw fixation. On loading the models with compressive forces in flexion motion, accumulation of von Mises stress over the implants was greater for models with lateral mass screw at C7, and also the variability in the stress at each intervertebral disc space was greater for models with lateral mass screws at C7. So a greater possibility of fixation device fracture was seen with the constructs terminating with lateral mass screws as compared to the pedicle screws. Stress at C6, C7 and C7 T1 intervertebral disc levels was lower for the constructs with pedicle screws as compared to lateral mass screw fixation at C7, and this was suggestive of the higher stress shielding by the pedicle screw at C7 as well as the adjacent disc levels. For both models where C2 fixation was done, lower stress was seen as C2, C3 level, and so adding a C2 par screw to the construct increased the constraint of the system and ensured lesser variability of the stresses across various disc levels. This in turn reduced the risk of implant fracture and related complications. The take-home message today is that ending a multi-level posterior cervical construct with transpedicular screw fixation at C7 vertebra provides a stiff, more constrained construct system with higher stress endurance to compressive forces. The constraint and durability of the system can further be enhanced by including a C2 par screw to the fixation. The current study with these finite element models pave way for more such possible future researches. Thank you.